What if I told you that a big part of hip pain is not really coming from your hip joint at all? That ache on the outside of your leg, that burning near your buttock, that pain that shoots into your thigh when you stand up, walk stairs, or lie on one side. It often starts in the tissues around the hip, or even in your lower back. And if you keep treating the wrong place, you can spend months stretching, rubbing, and resting, only to feel the same pain come back. In this video, you'll learn why that happens, what your body is really trying to tell you, and the natural step-by-step way to calm it down and rebuild strength. This matters because the research is surprisingly clear. Major medical sources say pain you feel around the hip may be referred from the back, and family medicine guidelines divide hip pain into front, side, and back patterns because each pattern points to very different causes. On top of that, modern rehab research shows that one of the most common side hip pain problems responds better to education plus exercise than to a wait-and-see approach, and even outperforms steroid shots for overall improvement over time. So if you want lasting relief, not just a quick distraction, you need the right target and the right plan. Here's where most people get trapped. You feel pain near the hip, so you assume the ball and socket joint is worn out, stiff, or out of place. Then you stretch harder, you twist more. Maybe you start aggressively pulling the knee across your body or digging into the outside of the hip with a massage ball. Sometimes that gives a little relief for a few minutes. But then the pain comes back angry. Why? Because irritated tissues do not always want more pressure. Sometimes they want less squeezing, better alignment, and smarter loading. Think of the side of your hip like a rope sliding over the corner of a roof. That rope is your tendon. If the rope keeps rubbing the edge all day, it gets sore, frayed, and sensitive. Now imagine you keep yanking on that same rope because someone told you it is tight. That often makes the irritation worse. This is one reason outer hip pain can flare when you cross your legs, sleep on the painful side, sit with your knees together, or keep pushing deep stretches. The tissue is already being compressed, and compression on top of irritation is a bad mix. And then there is the back connection. If your lower spine or the tissues around it are irritated, your brain may read that signal as hip, buttock, thigh, or even knee pain. That is called referred pain. It is like a faulty doorbell wire that makes the sound come from the wrong room. So you chase the outside of the hip, while the real driver sits a few inches higher in the low back or deep in the buttock. This is why some people also notice tingling, numbness, cold water feelings, or pain that travels below the knee. Those are clues that the story may be bigger than the hip itself. If this sounds familiar, stay with me, because the fix is not extreme. It is smart. And before we go deeper, subscribe to the channel and comment your country below. Join our family of wellness seekers. I always love seeing where you're watching from. And in a moment, I'll show you the one natural shift that changes everything. The hidden truth is this. Many stubborn hip pain cases improve when you stop trying to unlock the hip and start doing 3 things instead. First, reduce the positions that squeeze the sore tissues. Second, wake up the muscles that stabilize your pelvis. Third, reload the area gradually so it becomes strong again. That is the part many people miss. Painful tissue is not always a tissue that needs to be stretched. Very often, it is a tissue that needs a better job, better support, and a better workload. This is especially true for pain on the outside of the hip. Family medicine guidance says lateral hip pain is most often linked to greater trochanteric pain syndrome. That long name usually means irritated glute tendons, bursa irritation, or friction around the side of the hip. In simple words, the small muscles on the side of your butt are not handling load well, so the tissue gets cranky every time you walk, climb stairs, stand on one leg, or sleep on that side. It feels like a hip problem, but the real issue is often poor load handling, not a damaged joint surface. Now, here's the exciting part. In a well-known clinical trial on gluteal tendinopathy, people who followed an education plus exercise program did better than people who got a steroid injection or simply waited. At 8 weeks, roughly 3 out of 4 in the exercise group reported strong overall improvement, compared with a little over half in the injection group and far fewer in the wait and see group. At 1 year, the exercise and education group still led in overall improvement. That tells us something powerful. Your body often responds best when you teach it how to move and load well again. That does not mean every hip pain case is the same. Some front of hip pain comes from arthritis, impingement, or deep joint problems. Some back of hip pain comes from the low spine, the sacroiliac area, or the hamstring attachment. But the natural roadmap still starts the same way. Calm the irritation, restore clean movement, and build strength in the muscles that keep your pelvis level like guy wires holding up a tent. When those wires are weak, the whole structure sways, and every step becomes a small stress test. So let's walk through the process in the order your body likes best. First, you stop feeding the pain. This means reducing the positions that keep squeezing the sore tissue all day long. If your pain is on the outside of the hip, stop crossing your legs. Stop hanging on one hip when you stand. Avoid sleeping directly on the painful side. If you must sleep on the other side, place a thick pillow between your knees so the top leg does not drop and twist the hip inward. If you sit a lot, uncross your ankles, bring both feet flat to the floor, and get up every 30 to 45 minutes. Why does this help so much? Because irritated tendons hate being pinched over and over. They are like a garden hose bent sharply over a rock. Every bend adds strain. When you change the position, you reduce the squeeze. That alone can lower pain before you do a single exercise. The Ohio State guideline for this problem specifically warns against early positions that increase hip adduction, like crossing the legs or lying on the sore side, and even warns against aggressive stretching of the piriformis, IT band, and adductors during the early irritated stage. That is a huge clue that stretch it harder is often the wrong message. What do you feel when you get this part right? Less night pain, less pain when standing from a chair, less of that sharp stab when rolling in bed. Sometimes the pain starts feeling more like a dull ache instead of a jab. That is progress. A 68-year-old retired teacher went from waking up 4 times a night from side hip pain to sleeping through most nights after 2 weeks of changing sleep position, stopping leg crossing, and walking in shorter, easier bouts. And this is where it gets interesting. Many people stop here because the pain eases a bit. But if you only remove irritation and never rebuild support, the problem often returns. So the second stage is waking up the side glutes. These muscles act like shock absorbers every time your foot hits the ground. If they are late, weak, or tired, the tendon takes the hit instead. That is why stage 2 matters so much. Start with gentle isometric work. That means muscle work without much movement. Imagine pressing your knees lightly outward into a loop band while lying on your back, then lifting into a bridge only as high as feels easy and controlled. Hold for a few seconds. Breathe. Lower down, or stand next to a wall and press the outside knee gently into the wall without twisting your body. These are quiet drills, but they send a powerful message to your nervous system. This area is safe. Wake these muscles up. Why begin with this kind of work? Because irritated tissue often responds well to a calm, steady load. The OSU guideline notes that isometric exercise can reduce pain and help switch the muscles back on. Think of it like restarting a sleepy generator before turning the house lights back on. You are not asking the tissue to sprint. You are asking it to remember its job. This is also the stage where people notice a key difference between good effort and bad pain. Good effort feels like muscle burn in the buttock or side hip. Bad pain feels sharp, hot, pinchy, or lingers much worse for the rest of the day. A helpful rule from tendon rehab is that your pain should settle back toward baseline within 24 hours. If it does not, the dose was too high. That means fewer reps, smaller range, slower pace, or an easier version next time. A 71-year-old former mechanic with stubborn outside hip pain thought he needed more stretching because he always felt tight. Once he switched to short glute holds and easy bridges 3 times a week, his stair pain dropped noticeably over 6 weeks. The tightness was not a lack of length. It was a cry for stability. That is a lesson worth remembering. Then comes stage 3, and this is where your relief starts becoming durable. Now you teach the body to stay level when you stand, walk, and climb. This is where standing hip work, controlled side leg lifts, step-ups, and pelvic drop drills can help. Picture your pelvis like a tray carrying 2 full cups of coffee. Every time you stand on one leg, the muscles on the side of your hip have to keep that tray from tipping. If they cannot, the tendon gets overloaded and the pain returns. One excellent drill is a controlled pelvic hike on a step. Stand with one foot on a small step. Let the other side lower slowly. Then use the standing leg's side glute to lift the pelvis back to level. Small move, big effect. Another option is a banded side step with soft knees and level hips. Another is a side-lying leg raise, done with perfect form and no rolling backward. The goal is not to chase fatigue at all costs. The goal is clean control. When the control improves, walking often feels smoother and less threatening. This matters because daily life is single-leg life. Walking is one leg at a time. Stairs are one leg at a time. Getting into a car is one leg at a time. So if your rehab never trains that, you may feel better on the floor, but still hurt in the real world. Videos from high-performing rehab channels repeatedly do well when they show this progression from simple relief to standing control, and the evidence lines up with that approach. Gradual loading, not random stretching, is what helps tissue adapt. What will you notice here? Better balance when putting on pants, less wobble during stairs, less fear when stepping off a curb, and a little less pain after longer walks. A 63-year-old grandmother who used to lean hard onto shopping carts began doing supported step drills and gentle band walks. After 8 weeks, she was walking through the grocery store without stopping at every aisle. No miracle, just the right muscles finally doing their share. Now we reach stage 4, the part that separates a short-term fix from a true body reset. You reconnect the hip to the rest of the chain, because your hip never works alone. It works with your rib cage, your core, your spine, and even your feet. If your low back is stiff and irritated, it can send pain into the hip. If your trunk collapses when you walk, the hip side tissues get overloaded. If your foot caves inward every step, the chain above has to absorb that mistake. This is why you add gentle spine-friendly mobility and trunk control, not violent twisting, not forcing a crack. Simple moves, a supported hip hinge, a slow sit to stand with even weight on both feet, a marching drill while keeping your pelvis level, a short walking session where you focus on quiet steps and not dropping one hip. If your pain has back-like features, such as tingling, numbness, or pain below the knee, this is also the stage where you stop guessing and get properly evaluated, because referred pain from the spine needs its own plan. Popular videos often go viral by promising that one move will fix everything in 30 seconds. I understand why. Pain is exhausting, and quick hope is powerful. But even the better performing expert channels usually pair quick relief with strengthening and self-testing. The gap in a lot of popular content is that they do not always stress long enough progression, load control, or when to stop pushing. That is the part we cannot ignore if we want honest, evidence-based healing. So here is the deeper message. Your body is not broken. It is adapting to the loads you give it. If you squeeze the tissue all day and never strengthen it, it adapts poorly. If you protect it forever and never reload it, it stays sensitive. But if you calm the irritation, improve alignment, and then build strength little by little, the system changes. Tendons become more tolerant. Muscles fire sooner. Your walking becomes quieter. And the hip area stops screaming every time life asks it to do its job. Now, a very important safety pause. This natural plan is not for every situation. Do not use this as a do-it-yourself fix. If you had a major fall, cannot bear weight, have a deformed leg, have fever, rash, unexplained weight loss, night sweats, cancer history, sudden severe pain after long-term steroid use, or severe groin pain with loss of motion, those are medical red flags. Older adults who cannot walk after a fall need urgent assessment. People with worsening pain plus bowel or bladder changes, new numbness in the saddle area, or rapidly increasing leg weakness need prompt medical care. You should also speak with a healthcare professional before trying this plan if you are pregnant, recently postpartum, recovering from hip or spine surgery, or living with inflammatory arthritis, major osteoporosis, diabetes, related nerve problems, thyroid disease, or balance issues that make standing drills unsafe. If you breastfeed or are pregnant, unexplained pelvic and hip pain can involve the pelvic girdle in a different way, so proper evaluation matters. And if you use over-the-counter pain relievers, use them carefully. Cleveland Clinic advises not taking medicines like ibuprofen, naproxen, or acetaminophen for long stretches without guidance. Also, remember this: natural does not mean harmless if overdone. Too many reps, too deep a stretch, too much walking too soon, or pushing through sharp pain can all set you back. If pain is severe during exercise, or if it spikes and stays worse into the next day, reduce the load. And if your pain is mostly in the groin with catching, locking, or a big loss of movement, you may be dealing with a more joint-driven problem that deserves a proper exam. So how do you put this into real life starting today? For the first week, focus on calming the tissue. Stop crossing your legs. Stop sleeping on the painful side. Put a pillow between your knees at night. Break up sitting every half hour. Walk in shorter, easier blocks instead of long, painful walks. Use a simple pain score from 0 to 10 morning and evening so you can track whether the baseline is drifting down. In week 2, add your wake-up work 3 times a week. Pick 2 exercises only. For example, a gentle bridge with knees pressing slightly outward and a stand-in wall press for the side glute. Start with 2 sets of 5 to 8 slow reps or holds. Keep the effort moderate. You want to feel the muscles wake up, not the tendon flare. If it feels good, stay there for a few sessions before changing anything. In weeks 3 to 6, begin your standing control work. Add step drills, side steps with a band, or supported single leg balance. Keep sessions short. 10 to 15 minutes is enough if the exercise quality is good. Your timeline should be realistic. Some people feel less pain in 1 to 2 weeks after removing the main irritators. Better strength and steadier walking usually take 4 to 8 weeks. More stubborn cases can take a few months. Tendons often heal more like a garden than a microwave. They respond to steady care, not instant force. And keep an eye on the small wins. Are stairs easier? Can you lie in bed with less pain? Are you walking farther before you limp? Can you stand on one leg long enough to put on socks without grabbing the wall? Those are real signs of recovery. They matter more than whether you felt looser for 5 minutes after a hard stretch. So let's bring this home. A lot of what people call hip pain is not really a hip joint problem at all. It is often a load problem, a stability problem, a side glute tendon problem, or a pain signal coming from the back. And when you understand that, everything changes. You stop fighting your body and start teaching it. You calm the squeeze. You build the support. You load the tissue with patience. Type yes in the comments if this helped you see your pain in a new way. Like this video, share it with someone who needs hope, and subscribe for more science-backed wellness and longevity guidance. Your body can adapt, your strength can return, and this may be the moment your healing finally starts.